Hello to all my students and welcome to my channel Homeopathy with Dr. Mona Parmar. In today's video, let's learn about a topic and that is remedy reaction. So let's start with the video. So the first slide talks about what is remedy reaction. So if you read the definition, it says it's a correct interpretation of the changes observed after the administration of homeopathic remedy. You must be wondering, you have understood this before also in Kent's 12 observation. So in Kent's 12 observation, we were talking about each and every observation after administration of a homeopathic medicine and the prognosis, as in what is going to happen later on, that we are understanding through Kent's 12 observation. Now, in remedy reaction, we are trying to understand how a remedy reacts. Either it can not act at all, or it can produce an aggravation, or it can produce an amelioration, or it can go completely haywire. So in this remedy reaction, we understand in detail what are the types of aggravations which can occur and what types of amelioration which can occur and what can happen if the remedy does not act at all. Okay, so let's go further. So here in this, basically, as I told you, that there are various types of remedy reaction. So the first, which you must have seen in the OPD also, many people, we normally when we take the follow-up, that time we write status quo. We write SQ. So that is status quo. So that is the first remedy reaction. I'll explain to you what is status quo in detail later on. The first is status quo, second is amelioration, third is aggravation, fourth is new additions, fifth is change in order, and last is arrested progress or relapses. So let's study each one in detail. So the first thing, as I told you, status quo or SQ, we normally write in the OPD as SQ. So what is status? Now status quo means there is no change at all. When the patient has no symptom after or no change, not no symptom, it is no change of the complaints which the patient had. There is no change at all after the administration of the remedy. So the patient has come to you after the remedy which has been administered, and after that the patient has come to you. But there is no response, either neither amelioration nor aggravation. Okay, so there is no change. So the observation talks is when no change is observed in the symptomatology of the patient, even after waiting for an adequate period of time, that is called as status quo. Now, what does that mean? What does status quo mean? So, status quo is basically when the physician has probably missed out the remedy completely. It's a wrong selection of remedy. The physician has not probably perceived the case well. And that's the reason why a wrong remedy was given, and the patient has taken the medicine and it went out of his body just like that without acting at all. Okay, that can be one possibility. Another possibility is that if there is no error which is revealed on the part of selection of remedy, then probably the susceptibility was not favorable. Either it is too high or too low or whatever, but whatever remedy you have given, either that potency was very low or the potency was very high, but the potency was not the correct potency by which the patient could actually respond to the remedy. So mostly the potency has to be very low, then only it doesn't touch the patient. Okay, so in such conditions, the patient has no response at all, and that becomes status quo. Let's move further. So now in such condition, if the patient is SQ, what will you do? You reevaluate the whole case, correct the error if you have given a wrong remedy or if you have given a low potency or whatever, if you know that the susceptibility is very high but the potency you have chosen is low. according to the susceptibility, then you need to step up the potency. So you give the remedy accordingly. In chronic cases, but don't make a haste, because there are certain remedies which take time. So you should know the duration of action of remedies which are the common remedies. At least you should know that these many days will take for a remedy to act. Say, for example, Naxomika takes the action of the remedy is 7 days. So you know that the remedy is going to act. Sorinum is a remedy which takes 9 days to act. So you know that the action is going to take place after 9 days only. So that way you need to understand exactly how many days have passed, and whether the remedy has started working or not. We move further. Now, this talks about amelioration. Now, there are 5 types of amelioration. The first being simple amelioration. Second is apparent amelioration. Third is a short amelioration. Fourth is amelioration followed by aggravation. And then last is aggravation followed by amelioration. So we take one thing in detail. So simple amelioration here, you can connect it with the Kelstruel observation. Please let me know in the comments which observation connects to which amelioration or aggravation. So you can comment and let me know. So the observation is patient starts feeling better. Okay, so the patient starts feeling better. It's a simple amelioration. Now here the complaints are relieved immediately after the intake of the remedy. So now what is the response? The patient is absolutely feeling better after the remedy. The patient comes and says that I'm much better. So now what is the response? What is the inference? It refers to as an ideal response. This every physician would want to know. Have a kind of response where the patient comes and tells you that I am absolutely better. So this is an ideal, it's a rare thing which is for an ideal response. So now probably if it is there, then there probably there are only functional changes which are present. There is no structural symptoms involved, and the remedy and the potency which was given was absolutely correct. So you have not made any mistake. You have actually given a right remedy in the right potency. Now, second is apparent amelioration. Now, apparent amelioration means what? What do you mean by apparent? Apparent means it's just you are just seeing it for a time being. So symptoms are relieved, but the patient is not feeling better. So it's just that you are apparently ameliorated. You are feeling that you are relieved, but actually the patient is not feeling better. So symptoms have probably disappeared, but the patient does not feel better at all. So here what happens is that the disease is progressing with the decline of the patient, but there is no relief in the sufferings. Okay. So here the inference is that it's an incurable case and only palliation can be attained. So here in this case, that means it's an incurable case. The patient will not feel better generally. Those symptoms disappear or the symptoms come down, but the patient does not feel better. So now third is short amelioration. Now amelioration here, it means that amelioration has set in, does not last for an expected duration. It's a very short duration where the patient feels ameliorated for a just short period of time. Then again the symptoms start appearing. So now what is the inference here? Patient does something knowingly or unknowingly which cuts short the action of the remedy. So probably the patient has by mistake, knowingly, unknowingly, whatever, the patient has consumed something which has hampered the action of the remedy. So probably the patient has taken coffee or handled camphor, which can antidote the homeopathic remedy immediately. So that has to be told to the patient. Whenever you give a remedy, you have to tell the patient not to take coffee, a strong coffee, or not to inhale camphor, because that can antidote your remedy. So that must have interfered in the action of the remedy, and that's the reason why the patient felt better only for a short period of time. Or else what can happen is that in acute illnesses, here you frequently need repetition. You can't say that I'll give pulsatilla one in one dose and then let the patient become better. If it's an acute illness, you need to repeat the remedy frequently. So it needs frequent repetition. But if you give a single dose, it's going to last for just a short period of time. So amelioration is going to last for a short period of time. Now, in chronic illness where the disease has progressed further, in such cases also you might see a very short amelioration. So let's go further. Here it talks about amelioration followed by aggravation. So now amelioration is then followed by aggravation. That is, this is the observation which you see. So amelioration is there for a short time and then there is aggravation. So what does it mean? The patient became better only for a shorter period of time and then there was aggravation. So here it indicates a very bad prognosis. The remedy selection was probably superficial. So the remedy has just touched the patient and then it went away. So the patient did not feel better and the aggravation followed. So it indicates also it indicates that it can be a incurable condition. The patient is in an incurable state of disease, and that's the reason why there is a shorter period of amelioration, and then the patient again starts feeling the same way. Let's go further. Now, let's talk about aggravation. Now, there are four types of aggravation: simple homeopathic aggravation, prolonged homeopathic aggravation, killer's homeopathic aggravation. You are familiar with this word, medicinal aggravation. Now, let's take each one in detail. Simple aggravation. Now, simple aggravation means you observe a very sharp aggravation, a sharp initial aggravation, but patient feeling better in general. So there is a sharp shooting aggravation for just an initial period of time, and the patient has started feeling better. Though there is an aggravation, the patient has still started feeling better. So there is a general condition of well-being which is there in the patient, and then later on, so what we understand with this is that organic changes have not gone far beyond. It's just a functional setup, it's just a functional symptoms which have come up, and that's the reason why the patient has started feeling better. Just a slight aggravation which indicates a good prescription. So there can be a heightened response which can be seen initially, but the patient starts feeling better. So what is the solution? The amelioration will last for quite some time if it is not hampered. There are no new symptoms coming up in such reaction. Okay. Now let's talk about prolonged aggravation. Prolonged aggravation, all symptoms are profoundly aggravated for a long period of time, but then slowly starts feeling better. So the aggravation has been prolonged for quite some time. It's not a short aggravation. It is there for a quite some time where the patient is absolutely hassled with the aggravation. But then slowly and steadily the patient starts feeling better. So here the inference can be the physician has either ignored or was unaware of the advanced condition of the disease with cross-structural changes in the vital organs. This can be a possibility, or else a constitutional remedy was administered which proved out to be fatal. So the remedy which was given has probably given this kind of aggravation. This form of aggravation is a borderline subject to differentiate between killer's aggravation and prolonged aggravation. So you need to understand whether it's a killer's aggravation or it's a prolonged aggravation. So now what is the solution? The correct diagnosis must be made. you need to give placebo. That is, it is a golden rule that if at all there is a aggravation, the first thing is you give placebo to the patient, because that will allay his anxiety, that will reduce his anxiety to a great extent, and then you can think over what can be done. So, or else superficial acting remedy can be given in such cases where you just give a remedy which will just tackle these symptoms, and then you can think of giving other remedy. Killer's homeopathic aggravation, a very well-known topic, and a topic which you might know it very well. So here what happens is that there is a severe aggravation and the entire system is thrown out of gear, and the patient is suffering badly, and finally there is a decline of the patient. So here the case is absolutely incurable. It's an incurable disease, and the patient, you probably the physician has given a remedy which is deep acting, and which is probably with a very high potency. So the physician was aiming to cure the incurable case, which is not possible. So you need to know your limitations, you need to know your pathy very well, that if it is a incurable case, you can just do palliation, you cannot cure the patient. So you need to understand your limitations also. The physician was unable to diagnose the case due to lack of knowledge of disease. That can also be possible, that he doesn't know only that there is a progress of disease, and he is just giving empirically. Now, here the solution is that knowledge of disease is very, very important for diagnosing a case, that would help you to differentiate between a curable and an incurable cases. In such incurable cases, the physician should not think of curing. As I already told you, he should only try to palliate the patient. He should only try to temporarily alleviate the patient's condition, just soothe the patient so that his symptoms, which are very annoying, very bothering, and absolutely hampering his day-to-day lifestyle, that you should consider and give the patient according to that, so that patient feels better. Okay. Superficial acting remedies should be the physician's choice. So never think of giving any deep acting remedies in such condition, because it's definitely going to land up into aggravation. So think of giving very superficial remedies and very low potencies, not high potency at all. Medicinal aggravation. Now, what happens in medicinal aggravation? In this, we observe few symptoms of the medicine along with the simple homeopathic aggravation. So there is an aggravation, but you see symptoms of the remedy which you have given. So you will start feeling that there are symptoms of the remedy which you have given. So it can be seen in idiosyncratic patients who are absolutely, basically they are very hyper, and they throw up all the symptoms possible of the remedy. Or it can be an addition, new addition in the picture of the case. So your solution is that you differentiate between a medicinal aggravation and a disease aggravation. You need to understand whether the remedy which you have given, because of this, there are symptoms which have produced, or you need to understand whether the disease itself is progressing. So probably your remedy has made the disease progress, or whether it's a remedy which is producing its own symptoms. So you need to understand that. New additions. Now, here we observe symptoms which are not seen during the first prescription. There were no symptoms which were seen during the first prescription. That means these additions which have come up, that you have not seen during the first prescription, but have come up after the administration of the remedy. Now, what does it mean? It is a complex situation which requires good knowledge of natural history of disease. You should know how the disease is going to progress. So, if at all the patient has had cold with white discharge, and after giving the remedy, your patient started getting new symptoms, and the patient started getting yellow discharge, and the patient, so you need to know whether the patient has progressed. This is a progress of the disease. The remedy has caused the patient from a white discharge to mucoid to becoming purulent. So the disease has progressed further. So you have not halted the disease at any point. So you should know that your remedy has gone wrong. It's likely direction of the disease, its spread, the sphere of the remedy, or the basically sphere of action of the remedy's action. You should know these things very clearly. You should know the chronological order of the disease, should know the thorough understanding of Herring's law of direction of cure, and understanding of the case. With, if at all it's a poor symptomatology, you should know these things. Now, what is the solution if there are new additions? So, new additions are grouped into various types basically. So, the first is it can be sphere of disease. So, it can be related to disease, or it can be sphere of the remedy. Third thing, it can be an old symptom which has come up after many days, or it can be exteriorization, and lastly, it could be facilitation. So, let's understand this. So if it is a new addition and if it is because of sphere of disease, if the disease is progressing in an its natural manner and the remedy has proved ineffective, then it calls for an in immediate action and change in the prescription. Now, here what you have done is you gave the remedy and the symptoms have come up added. So it is that you have given the remedy and because of your remedy, the disease progressed. So if it's according to because of the it's a sphere of action of the remedy has caused the disease to progress, you need to understand that the remedy proved ineffective. It was a wrong selection and it needs to be stopped immediately. And you need to change the prescription because this remedy is not going to work for that patient at all. If it is remedy related, when the main, what happens when the main block of symptoms in the case is left behind and there are new symptoms that are, then that indicates that the wrongly selected remedy is proving itself. So here what is happening is that the remedy is given and the patient starts proving the remedy. Say for example, you have thought of giving a pulsatilla to a patient and the patient has symptoms, cough, cold, whatever, and the patient starts throwing up symptoms of pulsatilla. So if the patient starts getting symptoms of pulsatilla, the patient has other symptoms of pulsatilla, then you know that the patient is proving pulsatilla. So you need to understand that you are not supposed to give such remedy because the patient is proving the remedy. Okay. So here the action of the remedy will pass off if it is not too deep or not administered at high potency or not repeated too frequently. So you have given the medicine, but if at all you have given it repeatedly, then the symptoms are definitely going to keep on coming till the effect of the remedy lasts. But if you have given a low potency or if you have given very few doses, it will last for a particular period of time and then it will wear off. So, but if they don't wear off, if they don't pass off, then what do? You think of giving a antidote. So either you give camphor or you give, either you ask a patient to inhale camphor or you give a strong coffee. Now old symptoms, when these come up, now what is the observation? What you have observed that the patient has started getting old symptoms. Now old symptoms have started coming up. Now what does it mean? So now it means that sometimes the new symptoms are nothing but old symptoms for long forgotten by the patient. So new additions are there, but they are the old symptoms only. The patient has forgotten long back, maybe 10, 15 years back, the patient had, say 15 years back, the patient had urticaria. And now the patient is getting treated for asthma. And the patient, after you give the remedy, the patient has started getting urticaria again. So you are wondering whether it's a new symptom or it's an old symptom. But when you inquire further, you understand that it's an old symptom. The patient was had a history of urticaria long back, but the patient forgot completely. So understand, inquire correctly, understand the chronology correctly. It is therefore necessary for the physician to inquire into greater details of the symptoms and then differentiate whether they are really new or old symptoms appearing new, as I told you just before. According to Herring's law of direction of cure, in chronic cases during the process of cure, the old symptoms that are suppressed by wrong treatments reappear and show tendency to disappear on its own accord. So if this is a Herring's law of direction of cure, then you don't have to worry. They will be in a mild form and then they will disappear on its own. But if these old symptoms persist, and however, if it is considered what you are supposed to do, that if they are persistent, then you are supposed to give the same remedy which you have given in the same potency. And if they don't respond to that after giving the remedy and this with the same potency, you need to step up the potency. Okay. Now, what is exteriorization of the disease? Now, exteriorization means something which is coming up exteriorly. That means something which is externally you have got. So, externalization is internal improvement accompanied with manifestation of disease externally on skin or mucous membrane. This happens under the influence of proper homeopathic treatment. So sometimes the patient comes and says that I have got a rash, but probably internally his asthma is becoming better. So these are exteriorization. It is basically the remedy has caused symptoms on the skin, which is helping the body to recover. So this is under the influence of a proper homeopathic remedy. As the cure should take place from center to periphery, and from within outwards, this exteriorization of disease denotes a favorable prescription and prognosis. So it's a good prognosis. If, on the contrary, skin eruptions do not appear, then this state is often accompanied by general deterioration and spread of disease in the vital organs and systems. So if it is not observed, that means the disease is going further inside. This clinical state results from poor susceptibility and manifested by lack of reaction. It is, you might see that if at all there is a case of exanthematous disease, that means chicken pox or a measles. In such condition, where the child has measles or chicken pox, but there are no symptoms, no skin symptoms. There is nothing, no eruptions, no itching, no alert, nothing. So in such condition, it is just a poor susceptibility. Therefore, exteriorization should never be interfered with any medication, but should be allowed to run its course to its favorable termination. So you should not interfere with the action of the remedy. Now, change in order. Now, this is observation is that redistribution and rearrangement in the mass of symptoms. The symptoms have got completely changed and they are out of the, it's like a chaos. So here, either it is a response according to Herring's law of direction of cure, it can be contrary to Herring's law of direction of cure, which can be a dangerous prescription. Order is out of original chaotic symptomatology. So it's like a maze of symptoms. So here the solution is that response contrary to Herring's law of direction of cure, this requires immediate treatment with specific antidote according to remedy relationship. Maze of symptoms enables a good second prescription. You can accordingly make a new, fresh totality. Now, arrested progress or relapses. Here we observe either the progress of the cure has been arrested or there are relapse of the illness. So this type of response takes place because the previous remedy has done what was expected or a superficial remedy was selected. So superficial remedy was selected and the remedy could only help for a particular period of time, and then again the patient got the symptoms back. So it was the progress which was arrested. It is not moving further at all. The cause continues to operate unmitigated. So probably there is a maintaining cause which is there and it is not allowing the progress at all. The patient fails to observe the restrictions that promote the action of the remedy. So probably the patient, whatever, if you've told the patient to take rest and not to lift heavy weights for a backache or a neck pain, and the patient continues to do that, so there is an arrested progress. The patient will not become better unless and until he stops the maintaining cause. So in solution is, in such cases, the close study of hereditary influence helps to lead the physician to the path to cure. And in such cases, use of nosode takes a very good care in such situation. You can give a nosode, you can give tuberculinum, you can give bacillinum, you can give any nosode. Last is facilitation. As poor susceptibility would prefer the manifestation of the disease, the patient will present to the physician as a nondescript picture. Under these circumstances, the physician will administer the remedy listed under the rubric reaction poor. So here the patient will come up with very little, very few symptoms because the reaction is very, very poor. So that means the susceptibility is absolutely low. The patient is not able to react to any remedy. After the administration of such a remedy, a train of symptoms will appear which would have appeared if the susceptibility was not suppressed. This is facilitation which is brought by the remedy and it helps in second prescription. Okay, so if there is a reaction which is poor, you give a remedy according to the rubric and then see how the symptoms start coming up, and that will help you to find out the second prescription. So thank you so much for watching this video, and if there is any doubt, please let me know in the comments, and please do subscribe to my channel if not, and thank you so much.